Hi, I'm Dr. Ron Miller of cashbasedphysiotherapy.org, and today we're answering the question, as a cash-based clinic, can you see a Medicare patient? Okay, so let's just take a step back first, and if you're owning a cash-based clinic and you're seeing a Medicare patient and they want to pay cash for your services, can you see that patient? For one, if you're targeting Medicare patients, I would just recommend to be a Medicare provider and keep it simple. They actually pay somewhat decent. So if you're in an area that has a high Medicare population and you're running into this problem a lot where you're having a lot of Medicare patients that are contacting you wanting for treatment, just become a Medicare provider. I personally do not want that because I think Medicare is a flawed system. I don't like all the rules and regulations associated with it, and I don't, so I'm staying away from Medicare. I don't want anything to do with Medicare. So to get back to our question is, can you see a Medicare patient in a cash-based physiotherapy setting? And the answer is no. Currently in 2016, you cannot see a Medicare beneficiary for physiotherapy services if it's deemed medically necessary by Medicare guidelines. Plain and simple. Keep it simple. I mean, I don't like to make things complex. I just like to keep things basic and to the point. So I refer a lot of my Medicare patients out. If a Medicare beneficiary wants to come to me and pay cash for that, and it's deemed a medically necessary physical therapy treatment by Medicare guidelines, I have to refer out. Very few, the only way that you can see a Medicare beneficiary is if it is not deemed medically necessary by Medicare standards and guidelines. So it's not as simple as what you just say as just being, can I see a Medicare patient? You really cannot see a Medicare patient for a physical therapy service that is deemed medically necessary by Medicare guidelines. The only way that you will be able to see a Medicare patient if it is deemed not medically necessary by Medicare guidelines. So I hope this gets you thinking. I hope this answers your question. If you have any questions or concerns, you can make some comments on the lines below. I'll answer your questions within an hour. And I hope this gets you thinking about Medicare patients in a cash-based physiotherapy setting. Thank you.